Cody Barnett at Bodyworks Physical Therapy and Concussion Center, and we're glad you're joining us. We are here tonight for our Rotator Cuff and Shoulder Pain webinar. So thanks everybody for coming out and partaking. We're excited to be doing this. I've got a couple of people joining me tonight. Number one is Dr. Doug.
Hey everybody.
Dr. Doug Bonison is a wonderful physical therapist that I've worked with for going on
7 years at this clinic.
Altogether probably 25 years together. And then also joining us is a good friend of mine. This is Janai. And Janai is our special guest that I've been hyping. Yeah, sorry.
Well, thank you. I'm glad to be here tonight.
Yeah. And Janai and I got to be good friends working on her shoulder. And then since then, we've even become better friends because she helps me out with a lot of my biking issues and problems. So we're pleased to have her joining us and class up the joint a little bit.
That's my pleasure.
Yeah. So anyway, we're excited for everybody that here is joining us and logging in. And if you would, give us an emoji, give us a thumbs up or a wave or a something. Give us something that lets us know that you're out there, and we appreciate everybody hopping on tonight. So thank you.
Tag your friends that have shoulder pain.
There we go.
Go tag them right now. Tell them to get on here. We're gonna give you a lot of information about shoulder stuff because there's a lot of stuff that goes on with shoulders, and we're gonna hopefully dissect some things out, give you guys some answers on what's going on and why, and how to get some help. So that's the biggest thing.
Yeah, and maybe a little bit about why this can be so frustrating.
Oh yeah. Yeah.
Definitely.
Yeah, frustration?
A lot of frustration.
Yeah.
So, so without further ado, we'll get started. We'll start things up. So we're going to start by talking to Janai, and just a little bit of background. She's a super active lady, somebody that I admire greatly because she stays so active. And so if you don't mind, maybe just tell us a little bit about your shoulder story.
Sure.
And kind of how we got to know each other and where you were at.
Definitely. My problem started back in 2015 was when I first came in to see Cody. I came in as a referral from a friend who had shoulder issues also and was another cyclist. And he suggested, he knew how frustrated I was and that I was at my wit's end with my issues, and suggested I come in to see the guys here. My shoulders, before 2015, my shoulder issue had went on for 5 years. Started when I was working as a 911 call taker, and it started actually in my elbow and was just some sharp pains through my elbow, down into my wrist, up into my shoulder. As time went on, it got worse, and they sent me to workman's comp there. Through workman's comp, I went through 3 rounds of physical therapy, and it was a totally different physical therapy than what you guys did. It actually felt like torture chamber time. Every time I went there, I would come home horribly bruised, and it looked like I was beaten, you know. But 3 rounds of that, and nothing was getting better. In fact, it just kept getting worse. After that, they sent me to an orthopedic specialist. They did cortisone shots, which aren't very fun. Nothing helped. From there, they did EMG test. Everybody just kept telling me the same thing, that was carpal tunnel that was going into my shoulder and causing bursitis, and going into my elbow, that it was just all linked together. At that time, or before all this happened, I was involved in bicycling, kayaking. I had just got an archery bow, and I was excited to start using that. Me and my husband, we do motorcycle riding, rock climbing. And as this kept going on, I kept losing more and more feeling in my arm. It was causing numbness, and slowly I just had to keep, stop doing all the activities I liked. It was very depressing. It really was. And when I went in to see the neurologist, And he did the EMG study on me, and at the end there when he told me that it's just carpal tunnel, we have to wait until it gets bad enough for you to have surgery. He said, other than that, there's nothing we could do for you. And I literally broke down and cried in his office. I was so frustrated and depressed. And then luckily that's where my friend sent me to you.
Appreciate that.
Yeah.
Thank you. Yeah. And during that time frame, like in terms of how is that affecting your life? You know, you guys are really active and you like to do a lot of stuff.
Mm-hmm.
Were you had the issues with work and just doing your job? What was your activities that you enjoyed?
Well, and I forgot to mention that, but with work, after a few months of the physical therapy that they were sending me to, and it not getting any better, I actually lost that job. They said if it's not getting better, you probably should find something else to do. I went on to 2 other different jobs and subsequently had to change those jobs also because my shoulder issue was getting worse. I was getting more depressed at home. I couldn't sleep because of the pain. Just being in pain all day with my shoulder, I couldn't raise it up any higher than this. I couldn't turn my neck. I just couldn't get comfortable 24/7. I was in pain with it. So yeah, I'm sure my husband was very understanding and very caring at the time, but I'm sure that I wasn't much of a pleasure to be around either. But even with bicycling and all, we did. One thing that came out good from it is that we picked up tandem riding from it because I couldn't ride a bicycle by myself. So the tandem riding, I was able to still get out and ride some that way.
Yeah, and you guys still do that a lot.
We do.
Yeah.
It's just gotten better now.
Yeah. Cool. Well, thanks for sharing.
You're welcome.
So, Dr. Doug, if Janai was coming in to see you for the first time and she started laying all of that history down, what would be kind of in the back of your mind as far as like possible causes? What are the things that we want to kind of look at that could be the cause? What things do we want to, in our world we call it rule in or rule out.
Right.
What are the things that we want to rule in that could be the cause? What are the things that we want to rule out that aren't the cause?
Right.
What would be your thoughts based on everything she's telling you?
Right. This is kind of a common patient that we see. We see patients that have seen 3, 4, 5, 6, 7, 8 other practitioners, and they end up in our office. And we kind of, you know, kind of specialize in difficult cases that people can't figure out. And so when she was, telling her history, the things you start thinking about when you see elbow problems, one of the first places you go to is back of the shoulder. Trigger points in infraspinatus, subscapularis, trigger points there. Also cervical spine stuff. You look at necks, facet joints, nerve roots. You also look at the this is interesting, when you see elbow stuff, you always go to pec major and the subclavius muscle right here underneath the collarbone. There seems to be some correlation. When you work here and up in the back of the shoulder, a lot of times people's elbow pain will be like, boom. And so when this gets all tight and this gets all locked up, you're not saying a frozen shoulder, but you just can't move well because muscles are in such spasm. You got to get things moving. Ribcage mobility. Look at ribcage mobility is a huge thing for shoulders. Neural tension, rotator cuff. Sounds like you've had the rotator cuff looked at. And did you have an MRI on the shoulder?
I did, yes.
And that came back
Negative.
negative, obviously. Good. So that's kind of like good but depressing. You kind of want something so they know what it is, but then it's not. They go, well, I don't know what else to do. So those are the things that you think: cervical spine, trigger points, scapular mobility, ribcage mobility, here, collarbone, deep in the shoulder, deep in the armpit. Those are the big things that kind of stand out for me right off the top of my head.
So to summarize that, the location of the pain may be different than the source of the pain.
Yeah, when you see referred pain patterns, it's not, a lot of times it's not the site of the problem. It's usually a squeaky wheel, but the root is usually somewhere else. And so you can chase symptoms all you want, and that's what a lot of people do. They chase symptoms, but they never get down to the root. If you get down to the root of the problem and fix that, the symptoms all go away. Okay, and I think that's what differentiates us, because we've been doing this so long. I mean, you're looking for root issues, and you look and you know patterns of root issues, and root issues that look like this. You go look in other places, and you go, I didn't even know I was sore there. I didn't know I couldn't do that. Oh my gosh, that really hurts. Until we get on there and look at it and start working on it, and then you go, oh my gosh, I can turn my head. How's your elbow? Oh my gosh, it doesn't even hurt anymore. And so then you start working on things that are causing the squeaky wheel to be squeaky.
Right. So that reminds me of a patient I'm seeing right now. He's got some lateral elbow pain, some medial elbow pain with some nerve pain, all down here. And we came in, we started talking. Tell me what's going on. Telling me all about this stuff, right? But then we start talking some more.
You start rolling your head.
And I start asking him some more questions, and all of a sudden it comes out that, oh yeah, I had this old shoulder injury. We looked at this, and he can't externally rotate his shoulder.
Totally.
And but he didn't come in complaining of this.
No.
Guess what I spent about half of our treatment time on?
That.
Working on this.
How did that do that?
And then just by working on this, his grip strength got better by 20 pounds.
Exactly. Yeah. That's like normal. That's just kind of fun. People go, what was that all about?
Yeah.
Where'd you get that at? Oh, ancient Chinese secret. We figure these things out. That's what we do here.
That's an old reference, ancient Chinese.
Oh, yeah, remember that old Calgon commercial? That was great. So from the 70s, 80s?
Yeah.
Great dating ourselves.
Yeah.
Totally. We are so old. 80s music and big hair.
Oh yeah,
That
I've
rocks.
had it.
Very good. So one of the things that let's see, one thing before we talk about this is in terms of anatomy. So we've got a shoulder here. A lot of people know rotator cuff. They know the term rotator cuff. Nobody really knows, or a lot of people have a misunderstanding of what it is.
Sure.
You want to talk about?
Sure. It's also known as the rotator cup.
Yeah.
But it ain't no drinking cup, okay? It ain't coffee cup. It's a cuff, C-U-F-F, all right? So rotator cuff is 4 muscles, okay? And here's a right shoulder, okay? So this is here's a right shoulder. See that? That's the back side. Here's the front side, okay? So there's 4 muscles. The first one is on top, and that's this thing right here, right below, right kind of where your trap is at, right in there. It's called your supraspinatus muscle, and that's the most commonly torn muscle. And that's the one we do special tests called a full can and empty can test. That stresses that tendon right there, and that thing refers pain out into here. So a lot of people come in and they'll have shoulder pain. The shoulder problem, they'll go, it just hurts right here, my mid-delt, down here, my mid-arm, there. A lot of times that's this problem, okay? So supraspinatus is the first one. That's because it's above the spine of the scapula. There's a bone that runs right along the back of the shoulder blade, right there. Supra is above. Below the spine is the infraspinatus, okay? Now the infraspinatus is real common to have trigger points in it, and trigger points in an infraspinatus refer pain, guess where? Down the arm into the hand. So when people tell me they have pain in their elbow, their arm, and their hand, stuff like that, I'm rolling through my head. I'm going to go up and check this shoulder, check this muscle. And sometimes I'll push on the trigger points at infraspinatus, just below the spine, here and here, and they'll go, I can feel that in my arm. They'll go, what's that all about?
Sometimes down even into the thumb.
Into the thumb, yeah. So that's a real common one. And so the supraspinatus raises your arm like this. The infraspinatus attaches to the back side of the shoulder. So supraspinatus is on top, infraspinatus is back here, and what it does is it does this. It rotates your arm out like that, because when you have to roll your arm back to do your hair, throw a baseball, you have to rotate your arm out or reach in the back seat, or if you're a passenger in the car, you gotta grab the seat belt. You gotta be able to do that, okay? If you have a trigger point in there, or if you have a tear in there, it just hurts, okay? And sometimes if they do have a tear, you'll test it here, and you'll have them push out into it, and they'll just go like this. They'll just there's just nothing there. Does it hurt? No, I just don't have any oomph in it. So you start thinking, is there a tear in that muscle? The third one is called your Teres Minor. Now your Teres Minor, so we got supraspinatus on top, infraspinatus back behind. Here is the Teres Minor. Teres Minor is a smaller version of the infraspinatus, okay? Infraspinatus sits here on the bone. The Teres Minor sits on the side of the shoulder blade, and it's more right deep back in here, attaches on the back side of the shoulder blade, or back side of the arm bone, and it also rotates your arm like this, okay? That can get tight, and also with it's got a brother called the Teres Major, and we're not going to talk about that tonight, but that's another trigger point issue. The last one is called your subscapularis. So if I take this and this, we got supraspinatus on top, infraspinatus down below, Teres Minor. Now we're going to take the shoulder off, and we're going to go with this muscle. So this is the front of the shoulder blade, which actually sits on the rib cage. That's right there. And how you get on that is you have the patient bring their arm up, Teres Major come into the armpit, and then go back. Okay, and that gets right here on this subscapularis, and that refers pain to the back of the shoulder big time. They go, it's just like I just want to grab the back of my shoulder and just pull and just dig, stuff like that. We roll in our heads.
Or sometimes they'll say, I feel like it's really deep and I can't reach it. I can't touch it.
Yeah. You think that you start thinking subscapularis, and when you have them lay down and you check the trigger point on that, they go, oh my gosh, and you go over and check the other side, and it's like, yeah, no big deal. And so what that does is that pulls your arm in. Okay, that's like an arm wrestling muscle. It's one of the arm wrestling muscles. But when people try to pull things in, pull things up, because somebody had posted on a question about when I pull my sheets up on my bed, if you're pulling things into you like that, that muscle can give you problems if that's what's going on. Okay, and so those are 4 muscles. So let's review. Supraspinatus is on top, does this. Infraspinatus is back behind it, rotates out. Teres Minor rotates out, and the subscapularis pulls in. So those are the 4 cuff muscles. And then there's a bunch of different muscles that attach around it, but those are the 4 main ones I think that we see, or that people know the most about the rotator cuff.
Yeah.
So does that make sense?
Yeah. Now I'm gonna throw in one other thing,
Okay.
and that is the interesting thing about our shoulder. Flip that way for us. Is our shoulder blade is literally not attached to our skeleton. It sits out, and the only thing holding this in place is all muscles. We have one itty bitty attachment on the front of our collarbone right here. But otherwise, the shoulder blade sits back here, and it's all encapsulated in muscle. So therefore, when people have muscle problems or muscle pain or muscle issues, commonly causes us to have painful issues, because that's what allows it to be so mobile. But because it's so mobile, it depends on all this muscular stability, and so if our muscles aren't working appropriately around it, it makes it really easy for us to get problems. And if we didn't have that, we wouldn't be able to fully reach overhead. But the downside to all of that mobility means it opens us up for issues and problems if our shoulder blade muscles aren't working appropriately to help stabilize.
And one of the key things that causes shoulder muscles to not work is poor posture. So everybody that's online now, just sit up. You just sat up, didn't you? Whenever I say posture in the clinic, everyone kind of goes, and they hope I don't see them kind of sit up a little bit. Okay, right?
Yeah.
You say the word posture, you kind of go, oh yeah, I'm really slouching right now. But think about it. We're all in this coronavirus thing. You know, I've got people that are on their couches. They're on their, they're sitting in chairs they haven't been sitting in for years. They're doing their stuff in their lazy boy. They're all like this. And when you engage, when your head comes forward, it engages all these upper back muscles to engage. And now if you keep a muscle engaged for 6, 7, 8, 10, 12 hours a day, guess what happens? It gets tired. Okay? And it can't function like it should. And that's where we see, how many times do we give a posture lecture each week? Yeah, all the time. But so it's not rocket science, but it's very simple, because think about it. If you do this and this all gets tight. So watch what happens. I'm going to roll into your neck and upper back. So when I'm like this, my ear should sit right over my shoulder. Okay. If my ear, the plumb line, is forward of my shoulder, for every inch we come forward, you add 10 pounds of compression into your neck. Okay? 3 inches, 3-4 inches, 30 pounds of compression. So that's why neck issues with shoulder problems. You see that correlation. So then watch what happens when I slouch. Watch how high I can raise my arm. See how high that goes? It's pinching right here. It's stuck. Now watch what happens when my upper back can move. Here, see how much further I can go? So what happens is you see this bone right here? That's your acromion. So it's right here on the top of the shoulder. See the angle that sits at when you sit in a good posture? Okay? Watch what happens when you slouch. You bring this angle down. Now bring your arm up, and guess what happens? That pinches between your biceps tendon, your infraspinatus, supraspinatus tendons. You get an impingement sign. Or who sleeps like this? On their side or on their stomach with their arm above their head. They've been sitting in their desk all day. And I got a gal right now. She's like, my shoulder. I go, how do you sleep at night? She goes, oh yeah, on my stomach with my arm like this. I go, how's your arm move when you get out of sleep? She goes, I can't hardly move it. I go, stop that. Stop it. You ever watch that Bob Newhart show where he just says, stop it. Stop sleeping like that. That's bad. Okay? Because you're just creating an impingement. Just take your tissue and just ram it up underneath that bone. Here's the other thing. This collarbone is like a camshaft. Okay? Now watch. When my arm comes up, this collarbone has to be able to rotate. Okay? What if we're like this all day? This all gets tight. Camshaft doesn't move, you get a pinch right there. Find trigger points underneath that collarbone. That's why we have patients work on that, work on doorway stretches to help open this up. So when they move this whole system of linkage can actually work, and they can raise their arm up. But nobody looks here. They always go right here where the pain's at. That's not the problem. So, does that make sense?
Yeah.
Does that make sense?
Oh, definitely.
Okay. Good.
Very good. So, rotator cuff anatomy. You mentioned sleeping. We had a lot of people on the Facebook that mentioned difficulty, like a lot of people that had difficulty with sleeping.
Yeah, let's just sleep in this posture all night. Oh, my neck and back shoulder hurt. I wonder why.
Yeah, I wonder. So we definitely wanted to touch base on sleeping issues and how to at least make that better. So one other factor with sleeping is just the fact that we're not moving, right?
Correct.
We're sleeping for 6 or 8 hours or whatever it is, and just by virtue of the fact that we're not moving as much, things tend to get more stiff and stoved up, and then lack of movement will cause pain.
Right.
Right. The other is, like you mentioned, sleeping with an arm relatively overhead. That's really the killer. And you know, I try to work with people as much as I can because it's hard to sleep and be comfortable. But like if somebody sleeps with this arm up overhead like this, it's just like that's a no-go. We
can't do it.
We've got to solve that.
Yeah.
So that's one. And then the other thing is that we found is by supporting the neck and getting better support in this curve of our neck, that can take some of the pressure off of the shoulder.
Oh yeah.
So do you want to talk a little bit about the Pillowise pillow and how that works?
Yeah, and jump in here. I mean, we found with the Pillowise pillow, we actually measured you for this. You can go to pillowise-usa.com.
Yeah, in fact, Karen's going to put in the link.
Yeah, we'll put the link in here.
Look at this.
Pillowise-usa.com, and what we do is we measure you. And when we measure you, we find out what your neck circumference is, how far it is from here to here, and how far it is from here to here on the back side. So we measure how big you are, and whether you're a side stomach back sleeper, and whether your mattress is firm, medium, or soft. Because if it's firm, you're gonna be sitting up higher in the bed. If it's soft, you're gonna sink down. That's gonna change the orientation of where your head's at with the pillow. So you take all these factors in, and then they tell you basically which pillow, and it's color coded. Okay, we have anywhere from what color is that, Janai? Pink. Okay, we go pink and all the way down to I think purple. And so I got a gal who's a physical therapist. And she says she's had neck problems for years, and she says this is a knockout. This thing helps my neck so much, and we've had a lot of good results with people getting the right pillow that fits them, so they can actually sleep. Because you need to get in that stage 4 REM sleep to be able to repair. Because if you're up and down, up and down, up and down, up and down, up and down all night, you never get in that stage 4 REM sleep where your body repairs. So you're still recovering from the day before, but you haven't repaired anything. Because you've been up and down, you're exhausted. You drink more caffeine or take a nap, you fall asleep at your desk all day, during the day because you haven't had good sleep. And so good sleep hygiene is huge for just everything to heal.
Yeah.
So. And
this is size. So just like you wear different, not all of us wear a size 10 shoe.
Right.
Right. So this is sized. We actually get these from the Netherlands. Is where these are from. It's a special type of memory foam, and then it's sized specifically to fit you. And then we also can combine that with a mattress pad. And again, this is just a sample. Obviously a mattress pad would be bigger, but This is a sample of that, and you can tell how if we allow our shoulder to kind of sit down into that, and then we support that curve of our neck, whether you're on your side or on your back, either or, but supporting that and giving
Right.
better support in there is quite helpful.
Right.
And so we've had literally a ton of
Yeah.
people.
It's really
just
nice. And one of the things
raving
I
about
tell my patients, you can use 3 ways. You can sleep on this end, you can sleep on this end, and you can flip it over too. This is rocket science. Because everyone's different. I mean, you don't still make one kind of shoe. Everyone's sometimes okay. We're in the ballpark here with the right size pillow. Now you can finagle how it works for you. Okay, so people appreciate just different ways of trying things and using it. So if you need a new pillow, call us, get in here, let's measure you, figure it out, get you a new pillow. 30-day money back guarantee,
Yeah.
which is nice. So you can take it home for a test drive. And that's cool. Because we had a few people change things out. They go, you just know it's not a fit. Let's try that. Let's do this. Let's swap it out for this. And they go, okay, yeah, that fits. So sometimes you got to tweak it a little bit.
Yeah, and the company that we get these from in the Netherlands is like awesome to work with, and like customer service is off the charts.
Yeah.
So we've been quite happy, and more importantly, our patients have loved them.
Yeah.
They've been great. So we should have a link there for you in case you want to just research it, look it up, learn more. We'd be happy to chat with you too. So
Any questions? You guys have any questions?
yeah, we got
Type in questions. We're always good. We love bunny trails here because it's where you're at. And if we can answer a bunny trail, answer something where you're at, it helps you take the next step to getting better. Okay, don't feel bad or anything. Just say, hey, I've got this problem, or what do I do? Or and we do a lot of phone consults. We're doing more telehealth, and we're more than happy to talk with you on the phone. So we're gonna do a little thing at the end here, promote something, free consult on the phone to be able to just answer questions, because sometimes people have had a long history like you have, and they go, I don't even know what way is up right now. I just need somebody to kind of, maybe a fresh set of eyes or ears to relook at this stuff, since we look at things a little bit differently here and figure it out and get you going on the right track with some stuff. So,
Rhonda would like to know, how much are the pillows?
okay.
they are
$119.
$119.
And then tax.
$119 plus tax.
Yep.
Thanks, Melissa.
A little pricey, but how much is your sleep worth? We have people, there's no lie, people that have like 20 and 30 pillows.
Yeah.
Lewis would like to know, where should your arm be when you sleep on your side?
Good question. Relatively down here, slightly forward of your rib cage. And if we get something to support in there, better.
And the other thing I tell a lot of my patients, I tell them to get a hugger pillow.
Yeah.
So if they're on their side, they have a hugger pillow. I have one. I use a hugger pillow. Okay.
For the top one.
For the top arm. Yeah. So I'm down like this, and I have a hugger pillow here. So that's also when instead of laying on my stomach and my head's not totally cranked to the side, okay, I'm laying at this angle here instead of flat down. I'm laying here with a pillow here, less stress on my neck. Okay.
Lewis wants to know, should the shoulder roll forward when you lay on your side, or be immediately under your side?
Good question. Can be both, but not. The rolling forward for a long period of time just promotes a bad posture. If you can then roll over from your side a little bit more forward with like a hugger pillow, it brings it back, to your side. So that way you're stretching this out. You're not always in this forward posture pulling on things here. Good question. You can't really.
And my answer would be a little bit, it depends, because there's certain people with certain problems that you might need them in a certain posture.
Exactly.
More than another.
Yeah.
Depending on what's causing the pain.
Carol would like to know if you have any hints for better posture.
You want to do that one?
Sure.
Let's do that one.
Number one is be aware. Tell your family members to correct you if they see you in a bad position. And I'm sure your family
We all sit up
members
straight.
will be more than happy to let you know. So yeah, and especially if you have kids, your kids will be all over it if you let them know.
Yeah.
So number one is being aware. Tell coworkers or family, to help hold you accountable on that. The other is if you kind of think about it and start out that way, sometimes we'll lose a little bit. You know, if we kind of think, okay, I'm gonna really sit up tall and pull my shoulder blades together, and then just kind of relax off of that a little bit. It kind of gets your brain engaged to go, oh, this is kind of where I'm supposed to be, and this feels kind of good to do.
Yeah, this is not military, this is not here.
Yeah.
You don't do this. That's just wrong. That's just bad.
Yeah.
Okay?
So if I can interject, when
Yeah.
we were kids, my mom used to make us put a book on our head and practice walking around with it to get us with good posture.
Yeah.
I should have continued it through a time when I was an adult,
Yeah.
but
You have good posture.
Yeah.
You have good posture.
Yeah, you look
once I
great.
get tired and I'm like.
Yeah.
And then Marie says, she's asking about carrying a briefcase on your shoulder and how can that cause damage, and how would you address that?
Like with a shoulder strap.
Mm-hmm.
Am I understanding that right?
Yes.
Yeah. So if we're always carrying a purse or a shoulder strap or something, let's say it's on my right side and I'm always putting it on the right side, then in order to hold that in place, I'm always engaging these trapezius muscles up on our side of our neck, and that, so that I'm always constantly basically having to do this, right? So this muscle then becomes overworked and underpaid, and then it gets angry and painful, right? So you could say, well, maybe I should just alternate and switch, but then this one tends to get overworked and underpaid as well. So a better way is to do the cross, where you're bringing that strap across diagonally. If you're going to wear a shoulder strap, we always recommend people do it like diagonally this way versus hunching it on one shoulder. Then
Right.
gravity holds it in place.
Right.
You're not having to crank this shoulder up to hold things in place. Am I explaining that okay?
Yeah, very good.
That makes sense.
Very good. If I can jump back to the posture thing, an idea on the posture. I did a Facebook Live video, I don't know how long ago, but is with posture, we're actually seeing posture be this problem. Okay? And let me go a little bunny trail here. If you have good musculature here, okay, it keeps you up here. If you have a muffin top, y'all know what a muffin top is? These things? Yeah. If you have a muffin top here, and these muscles are not strong here, you have more tendency to slouch. But if you have more strength around your midsection, when muscles engage, they have more resting tension. You're stronger here, from here to here. You're more apt and easier to sit up straight. But if you're not, you do this. And then, if you do this for a long time, you get the hump. Who all knows somebody that has the hump? Okay? That big round thing? Okay, your body adapts to the positions it's put in. So, for example, you break your arm, you put your arm in a cast for 6 weeks, take the cast off, where's your arm move? Stiff, right? Same thing with your posture. If you do this and this, and do this and do this, guess what happens? There'll come one day where you cannot straighten up anymore. It is actually adaptively shortened to that position, and then you have it. And then gravity just starts taking over. Okay? So you want to be really aware, and one of the other things we have people do is do like a doorway stretch. Put your arms in a doorway. You've done that one?
I do it regularly now.
Yeah.
Just to keep everything moving.
Yeah, it helps open this stuff up so you can actually raise your arm up. Because think if you can't do this, you can't look up very high. You can't raise your arm up very high. Open this up in a doorway and lean through to help stretch this and to make this straighten up so you don't just get real stiff. So, good. Great questions. Great questions.
Rhonda would like to know what would be a good exercise to strengthen the shoulders.
Well, the short answer is, Rhonda, it depends. So
There's a lot.
we just covered about 30 different problems, 20 different problems tonight. And so the short answer is it's a great question, by the way. I'm not trying to make light. It's a great question, but the short answer is it depends. What's the root cause? And
Right.
so the best shoulder exercise for you might be different from the best shoulder exercise for Dr. Doug or for Janai,
Right.
depending on what is at play and what's going on.
Right.
So in people, I think commonly people are used to going to Dr. Google or Dr. YouTube and looking up exercises, and we do exercises videos all the time as well.
Sure.
But where I'm going with that is exercise is every bit as powerful. In fact, I would even argue more powerful than drugs.
Totally.
In terms of the
Totally.
the effects and the benefits. So we don't want to just blanketly say do X exercise without knowing.
I think one of the key factors is I just did a talk for a professional group a couple weeks ago, and the name of the talk was "Is Sitting the New Smoking?" And the clinical research shows that the side effects of sitting is worse than smoking. When you sit for 30 to 45 minutes, what happens is your metabolism downshifts 80 to 90% because you're inactive. So it just slows down. So one of the things that is the antidote to that is movement. That's one of probably your best exercises, just moving, being in and out of different postures, sitting, standing, exercising, walking. I think standing at your desk, standing if we're all at home, stand at the bar, have your computer there, change positions. That's the key, is just changing positions every 15 to 20 minutes. 15 to 20 minutes, you're changing positions. That will clean up a whole bunch of stuff, because what we see in here is people are they're just stiff, and we just unstiffen them, and they go, oh my gosh, I feel so much better now. What do I need to do to keep this going? Right? This is not rocket science. But just, I think movement is probably your best type of exercise, as opposed to doing this and doing this for hours on end. So if that can answer your question there, Rhonda. So good question. Keep them coming.
I've got two from our Facebook earlier. They're two questions, but they're the same question. That is, people worried about the pain in their shoulder might be coming from their neck.
Si, senor.
Yeah.
Yeah.
And can neck problems, like what I find is neck problems and shoulder problems, typically it's a little bit of both too.
It is.
In that we can certainly get referred pain from the nerves in our neck that will refer pain down into the shoulder blade, the shoulder joint, the arm and hand, but then we can also get that from the shoulder, and typically when one is kind of angry, certainly the other can be angry, and then they kind of feed each other.
Mm-hmm.
My shoulder gets sore, so that makes my neck hurt, or my neck gets sore, makes my shoulder hurt, and then it's kind of this symbiotic yin and yang sort of thing where one is irritating the other, or vice versa.
Right. So that's why you have to work. You have to a lot of times work on both. You got to work on necks, shoulders, upper back, thoracic spines, rib cages, trigger points. Get the whole complex from here down to here in this whole upper quadrant. Most people just focus. A lot of times we'll focus here. No, we're working the whole upper quadrant, because it's all tied together. And sometimes what you'll do is we do what's called a test treat retest, where I do this all the time in the clinic, where I'll take a measurement or something, then I'll work on one thing. I'll go, Seven, let's change it. Let's see if it works. They go, not much better. Okay, lay that down. Let's work on something else. Not much better. I'll work on something else, and they go, oh my gosh, it's better. I don't have any pain now. And you go, okay, that's kind of their key. That's kind of their root issue that's hanging things up. You keep that going, then you can show people how to keep that going away and stay away. And they just walk out of things. But a lot of times, necks are huge. Necks are huge for shoulder issues, numbness and tingling, referred pain from the neck. You loosen all this stuff up. A lot of times your shoulders are just,
Janai, I think you tend to have a fair amount of that.
Oh, yeah.
Kind of neck and shoulder working
Definitely.
together.
Yeah, it was from the neck all the way down to my fingers, so it was the whole side.
Yeah. So did Cody work on your neck some?
He did, actually through the neck and underneath of course underneath the scapula, and just a bunch of different, techniques there that actually, because everything needed to be worked out, and once he did, it was just amazing how fast it went away. After being, in pain for 5 years, and them saying, oh no, it's not gonna go away, and within, within the first, treatment, I felt better.
Isn't that fun?
Yeah, it is.
It gives you hope. We have people come in, and I ask them what their goals are, and they go, I just want some hope. I don't know how many times that happens, because they've been through the process, and they go, I just want some hope. I go, all right, you're in the right place, let's figure this out. And usually within 1 or 2 treatments, there's a change, and they're better. So that's just fun. We just love what we do.
Do you have any more questions, Melissa?
We do. We've had one question about what if I'm in a wheelchair and can't stand up. And
That's a great question.
Mm-hmm. Okay, good question. Wheelchair, so you're sitting. What you can do, and let's roll into a little bit of back issues, okay? Here's what I have patients do. I have them sit up straight, then I have them slouch. I have them sit up straight, and and slouch. I have them do that 30 or 40 times. It's like when people drive a lot, they sit in their car and never get stiff. If you can just even get your low back and your pelvis moving like this, that actually affects what happens up north here. Okay, as opposed to just sitting with your hips rolled back. That's something there. You can do shoulder rolls to be able to open this up while you're sitting. You can go into a doorway, and you can lock your wheels, put your arms up in the door handles, and then just kind of lean forward a little bit. Okay, that's something like that. You can also use like a wand or a stick. You could lay down in the bed and just bring your stick over your head and just kind of stretch your shoulders a little bit. And you can stretch your shoulders out this way and out this way. So there's lots of workarounds for being, if you're in a wheelchair. I don't know if it's, what your situation is, but those are just some simple things you can do to stretch. But again, movement is the key. Movement.
On a side note too, if you're always in a wheelchair, there are some seating in terms of pad and seat sorts of things that can be sometimes modified, which isn't really our specialty.
No.
But we know people whose specialty is wheelchair seating. So if you're always in a wheelchair, that might be something to either investigate, or we'd be happy to get you connected with that person that works on wheelchair seating, because what your rear end and lower back are doing dictates what
goes
on
up north.
Again,
root problems, symptoms.
Yeah.
Symptoms here, but root problems are coming from down here. Yeah.
And then one person asked, does sternum pain have anything to do with shoulder, neck, or how you sleep?
Yeah. Some people have like a costochondritis, where that pec muscle comes in, or the joints where the ribs come in and attach to the sternum. Yeah. And when we find like a costochondritis, where you're tender right on the side of your sternum, where the ribs come in and attach, there in the research, what you find is you go back behind and you start working this. You get that upper back moving and the shoulder blades moving. So because the ribs attach back here and they attach up front, and they're just really inflamed here, they're just locked up. And so you actually work upper back, and then we also use the laser to help with that, which is really nice. Again, but getting things moving, because that is a symptom of other hypomobility or lack of movement areas. So yeah, great question.
Yeah, that's a good one. Doesn't happen as often, but we
No, you don't see it.
definitely see that in the office.
Yeah. I had one gal, she couldn't even hold her baby. She had a newborn baby, and she couldn't hold her baby because it just hurt so bad. So she literally could not use her arms because it just hurt so bad. So her husband would drive her here. We worked on her. It took us about probably 2 weeks and probably 80% better. So she would hold her baby. So that was good.
And then Cindy would like to know if a referral from a physician is necessary to come see us here at Bodyworks.
Nope.
No. You can call us up and you can say, can I get an appointment with Dr. Doug or Cody? And that's how, in Kansas it's called direct access, where you can call and don't have to go through a physician. And actually it's good right now because of all the coronavirus. We're open because we're helping keeping people out of the doctor's office where they're really sick. So people have musculoskeletal problems, they injure their neck, shoulder, back, whatever, come here because we don't have all of the, I don't want to say really sick people, that get people better and going without being exposed to something that's in a doctor's office.
Our part of our role during the coronavirus is to try to keep people out of the emergency rooms and out of the doctor's office. So.
Right.
Well, one thing I wanted to do is roll back to Janai a little bit in terms of, we talked a lot about your history and how things were. So where would you say, in terms of today or your life now, how is your life different? Where are you at? And kind of bring us up to 2020.
Well, since I finished therapy with you, I do follow still some of your exercises on a regular basis. Just if I'm tensed at work or something, I just kind of feel this getting tightened up again. I actually do the push-ups. I do that in the shower. So this way hot water's hitting it, and I'm doing that, and that just kind of helps loosen everything up. But I actually work at a bicycle shop, and when I was seeing you, I was working at the bike shop, but I wasn't able to lift bikes up over my head. I couldn't push them up the stairs to bring them up from the basement, and I have no problems doing that now. I actually we are moving out of state, and my new position will be back as a 911 operator. I'm really excited about doing that because it is something I really care about. And I know now I'll be able to do it without having all these issues. That'd be nice.
Yep.
But
Now, I know you do other stuff.
I have. We've actually, you know, I've continued on, and now I am shooting my bow, gun shooting, my motorcycle. You know, I've been able to do that, no problems. As soon as all this clears up and I get down into Arkansas, I'm looking at doing some rock climbing now also, and doing the kayaking and not having any of that issue. So, getting back to everything that I enjoyed doing before,
Yeah. Yeah.
and all the mountain biking.
Yeah.
Fine.
Yeah, so anyway, I talk about how much I appreciate Janai because you're my dream. Like she rock climbs, she mountain bikes, she shoots bows and arrows, and like I just think it's awesome.
She's a Renaissance woman.
You're
You're a Renaissance woman.
First one
Can you cook and clean fish?
Actually, yeah.
Yeah, all right.
Yep. So.
All right.
anyway,
That's good.
So it's been really cool to see your progress, and you know we still talk relatively regularly, and so you know every time I see you putting a picture of some place you guys went exciting, you know, just it makes my day just to see you be able to do the stuff you love to do. So.
Oh, I really appreciate it's impressive you guys that I'm able to do that again. I had really thought that, you know, at being my age, you know, when you start having those issues, you think, okay, that's going to be it for the rest of your life, and this has just increased it, you know, my time doing that. So I really appreciate it.
Yeah.
It's been really wonderful.
That's awesome. Yeah. Well, we're glad you came here and classed the place
Yes,
up.
thank you.
Yeah. Well, thank you guys for inviting me. I really enjoyed it.
So, a couple things, and I know we got some more questions. I can't read that. So I know we got some other questions, but one of the things that we did want to offer to everybody that's here, obviously we are battling coronavirus, and so we are still open and seeing patients either via in person or online via video, but we certainly are trying to do as much as we can via video just to kind of help with the restrictions. Even though we run ozone and we kill viruses and we wipe everything down here, we're really on top of that. But we are trying to do as much as we can virtually during this time frame. But because of that, one of the things we want to offer is everybody that's watching this tonight, if you want to see if you have something that you think you're interested with what we've talked about tonight, and you want to know if we could be able to help, Karen's going to be posting a link down in the comments section, and that link will just take you to our website, to our request form. And basically, anybody that wants to is absolutely free, no obligation. We're not going to put some hard sell on you or anything like that. Basically, if you go to that and we just want to sign up for either a free phone consult or video consult, we call them discovery visits. You can sign up for that. Just go to the website, give us your contact information so that we can contact you, and then we're happy to offer that for anybody that is interested. So look in the comments there for the link, and like I say, we just, the reason we do these is because we know there's lots of people suffering, and we want to make sure that people know that there's options out there, and know that there's options for hope and help, and offer that. So feel free to look at that, contact us through there if you would like to, and then have we had any other new questions that come up there? Okay, so one of the things that I wanted to close with is we had a couple people. I asked the question in the event in terms of people's number one concerns, and there's actually two that really stood out to me. One was one number one concern is if I don't take care of this now, then in 10 or 15 years I'll be having shoulder surgery. So rotator cuff surgery is a drag.
It's not on your bucket list.
It's not on
your
the
bucket list
not on the
now.
to-do list. And so that is one of the things that we feel strongly about is we want to be proactive. We don't want to be reactive.
Right.
And what can we do to try to prevent people from having to undergo things like injections or unnecessary surgeries or things like that? If we can do it without having to have somebody rely on pain pills. Like that's a common refrain that we hear is people coming in and they're basically living on pain pills all day long.
It's been going on for years. I've seen so many people, I don't know what else to do.
Yeah.
Yeah.
So we want to be proactive, not reactive. So to the person that posted that, basically that's our goal. Like we want to be proactive and what can we do to help so that you're not having to have shoulder surgery in 10 or 15 years. The other person that's kind of on the flip side of that said how to avoid tearing it again because I've already had 2 surgeries on my right. This is somebody that's already gone through the surgeries. Again, they're a drag, they're no fun, and having to go through it twice. So there are things that you can be doing to try to minimize the risk. Like there's no guarantee. Like certainly you can be in a car accident, or you can fall off a ladder, or you can slip on the ice. There are things that happen that we have no control over. Absolutely, but by the same token, there's definitely things that you can do to minimize the risk.
Yeah, lots.
So just like if you stop smoking, that decreases the risk of lung cancer, right? Well, there's things that we can do for our health and our shoulders and so forth that if we employ those techniques and employ those things, that we can at least reduce the statistical risk, and that's basically what we specialize in.
Right.
So,
You have to become beware. No, how's it go? Aware, so you can beware. We make people aware of things, so then they can beware of what's causing a problem or potential to cause a problem. And some people, a lot of times, that's what we do. They wouldn't even think about this little position, this little change, or sleeping with my arm above my head. They go, that can hurt my shoulder? You go, oh yeah, lots. Mm-hmm. And they stop doing it for a week and they come back and they go, my shoulder's better. I go, yeah. I mean, it's just sometimes these little 2-degree changes, like when you're going on the interstate and you kind of veer off on the shoulder and you hear that blub, 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 you make like a little 2-degree change to get back on the right road. A lot of times that's what it is here in therapy. Sometimes you just kind of get on the shoulder a little bit and you just make a little 2-degree change, come in here, let's get some things tuned up, get back on the road, so then you're going down the road free and clear without any issues. A lot of times, seriously, that's a lot of them just tune-ups. They just don't know. So there's a lot of things that you can do for just helping shoulders, necks, upper back stay healthy. But people you just don't know, and that's okay. That's what we're here for. That's our expertise. That's our wheelhouse. So yeah, if you have problems, feel free to reach out, give us a call, tag somebody that has shoulder pain, tell them to watch this video, have them call. We do a lot of phone consults and stuff like that, just to have people, we want to hear your story. We want to hear what's going on. Because I think in medicine today, it's such a rat race. People just run through like cattle. And here at Bodyworks, we'd rather do quality work than quantity work. Does that make sense? Because we see where the herd goes, and then we go that way. So we're doing quality work instead of just running people through, 30, 40, 50 people a day. No, we want quality work. We want to hear your story, we want to hear what's going on, and we want to have time to figure it out. And that's what we like to do here, is figure things out. Because if a lot of people just don't take time to figure things out, and it's just fun when you get to the root of the problem and they're better, and they go, oh my God, how many times you heard this? Why didn't I come here before? Oh my, how many times have I heard that one? Oh my gosh, I should have came here first 3 years before.
Or the other, which really makes me sad when it comes to our medical system. I had this happen last week, is somebody, actually not on a shoulder, but we're working on her lower back, and had seen a PT, 2 doctors, and literally I was the first person that actually examined her and put literally touched her with my hands.
Yeah, right? I say it all the time.
And like, I mean, I'm glad that we're helping her, but it just makes me so frustrated with our medical system.
Sure, because they have to run numbers through to make it work.
That's what happened with me. I think everybody just kept looking at the last doctor's notes and saying, oh, it's carpal tunnel, that's what you got.
Mm-hmm.
And within the first hour, you told me it wasn't carpal tunnel.
Tunnel.
Just by simple test, how many fingers are getting affected, and you're able to tell right from that. I was just blown away by that.
Yeah. Yeah.
So a good physical exam trumps a lot of things.
Oh yeah, we rock on our physical exams. I ask people that have seen multiple other people. I say, I go through my physical exam and I'll ask them, has anybody done this? No. Have anybody done this? No. Have anybody done this or this? No. No. And so that's kind of the fun part, is the physical exam, to figure out what's really going on.
Yeah.
So, question?
We have one last question. Should I be even more concerned if my arm and hand go numb and ache sometimes while just rest? And what sleeping position is the best to prevent extreme pain in the middle of the night? And then she follows up with, what do you think of dry needling for shoulder pain?
Good question. Yep. So let's start with the last one. Definitely dry needling can be quite helpful. We do that here, and we talked a lot about trigger points tonight. So it can be quite helpful in terms of getting pain relief that way. Helps with muscle spasm and so forth. And even though we do that a lot, and there's great research on it, great science on it, typically we also want to still make sure we're doing the other stuff in terms of getting down to the root cause of the problem. The question about numbness,
Arm falling asleep.
arm falling asleep at rest. Sometimes this actually, probably we could do another webinar on this probably, but there sometimes there can be other factors. So for example, are we getting something referred from the neck and a nerve getting pinched here?
Mm-hmm.
There's a condition that can impinge on the artery and nerves where they come out through the front of our chest and the armpit, called thoracic outlet syndrome. We've actually got, let me think where that's at.
You did a video
If you go to our website and click on the blog page, pretty sure I've got a blog.
Okay.
Yeah. Pretty sure I've got a blog post on that on our blog page. So there are some other things beyond what we've talked about tonight that can cause that numbness down the arm and hand,
Right.
especially at rest.
But definitely get it checked out. Definitely get it checked out.
But the bottom line is
Yes, be concerned,
it's not
because
normal.
it's not normal. You need to have that checked out, so you can, if you want to call the office, in the morning or tonight, leave a message.
Yeah.
Leave a message. We'll get back with you, get you on the schedule. Let's take a look at that, because that's something you don't want to just let go.
That's not
normal. Something's getting pinched or shut off or
Yeah.
something like that. Something's not right.
Or click on the link. We've got the link up there. Karen, post that for us.
Yeah.
The call request link. We think it's on there.
Yep.
If it's not, we'll go back after and plug it in. But I think I'm sure Karen's got that posted for us.
She does.
But click on the link, and we'd be happy to set up a consult with you too. So, but we're running out of time, so we probably should wrap it up. Janai, do you have anything that you would like to close with?
No, just keep moving. That's the main thing. Keep moving, stay active, and
moving.
I'm happy that you guys got me where I can stay active.
Motion is lotion.
Exactly.
Keeps it moving.
Yeah.
Keeps things moving.
So our mission is to keep people mobile, active, and off pain pills. And so if that sounds interesting to you, feel free to contact us either through the link that we gave, our phone number 316-558-8808, and our website bodyworksphysicaltherapy.net. If you happen to be watching this video after the fact, after it's been posted either to Facebook or to YouTube, we'll put the appropriate links in there as well. I want to thank Janai especially for coming tonight and
welcome.
taking time out of your day to bless someone else. And
Somebody has your story out there.
There's
There's another one of you out there.
yeah.
Yeah.
So,
Hopefully they heard it. Hopefully you heard it.
yeah.
Oh.
Take the next step and call, and it's okay to ask for help.
So thank you for blessing others and being willing to share your story, and appreciate that.
You're welcome. Thank you for
Yeah.
asking me
Yeah.
to come tonight.
Yeah, my pleasure. The pleasure is definitely all
Yeah,
ours.
thank you.
And so, and then want to thank everybody for watching. So we hope this was helpful. We'd love it if you give us a thumbs up or
Tag somebody.
something just to let us know if you found this helpful. And if you have other questions, we can go back and if there's any other stuff that you think of later and want to come in and post it, we'll try to keep tabs on that and answer your questions. But we appreciate you taking time out of your day to learn more. And thanks to Dr. Doug.
Thank you.
And on the back side, we've got Melissa and Karen helping us tonight, so thank you guys. And until next time, make sure you click to get notifications, because we do these at least every 1 to 2 months. And so feel free to click that, like our page and so forth, so you get notified. And we appreciate everybody for taking time tonight. Thanks.
Thank
Bye,
you.
everyone.